Hello everybody and welcome to this month's video message. Suzanne has asked me to introduce our message this time, which has been about our new Team Talk event. Team Talk is an opportunity for all of Team ASPH to get involved, find out what's happening and have your voice heard.
Good morning everybody and welcome to this, our first Team Talk. If those of you who've seen the messages will know that we've been trying to think about new ways to have conversations with yourselves. We've been trying new things, the podcast, the videos and so on. And so this essentially is the replacement for what used to be Team Brief. So we'll start with highlights from our quality of care work. So I'm going to hand over to David and to Sue.
We want really interested in how do we learn when things go wrong, and how do we learn when things go right, and how do we start to move that forward. So one of our objectives was to become a learning organisation, and we've done a huge amount of work in the Learning from Debts programme. So that's a national programme that started last year, and we are compliant with it in terms of reviewing debts, using a structured judgment review and learning from that.
And I suppose one of the big successes, I think, that we've identified that actually medication safety is incredibly important. Medication errors cause a lot of harm and suffering to patients, and we need to make sure that we reduce those as they go forward. And I think that programme that's been in place through the Quality Department has been fantastic in highlighting where these errors are occurring and therefore raising people's awareness so they can take action to do that. And it's also supporting us understanding what other infrastructure we need to put behind to improve that situation.
We have done a huge amount around recruitment and retention, as hopefully all of you will have seen. I think we set ourselves a target to try and recruit 200 Band 5 nurses this year, and we achieved 183.
And we've had some big successes in the last 12 months. In our IMSK department, we've taken out thousands of outpatient consultations through the way they've redesigned the trauma service through the fracture clinics, which saved thousands of appointments. Patients are no longer required to come into the organisation to have their care progressed. And the same in neurology, where I think we've moved around 3,000 consultations to a non-face-to-face method.
It's the start of a really important kind of next 3 or 4 years for us, that you'll see simply massive changes across the St Peter's site, but also over in Ashford as well, as we continue to develop those services. So it's been a brilliant year. The team have done amazingly well.
A really important part of our ASPH transformation is digital. So Simon's going to talk us through that.
It's about a year until we actually go live with those systems. So that's probably going to be early May, what's that, 2020. We're also doing it in partnership with Royal Surrey. Our records, their records, you'll be able to see all of the acute records, cancer pathways, those sort of things, all in the one patient record.
We've got an awful lot of work that we need to do, and that's work that we need to do in partnership in our local integrated care partnership area, North West Surrey, but also across Surrey Heartlands and wider. So lots of really good and important, interesting work going on there. And I'll use this opportunity also to mention the Community Day. So this is us opening our doors and collaborating with our local community, our local populations. 6th of July, get involved and show the population what it is that you do and showcase that.
I know it's hard and I know there are challenges, and this is your opportunity to ask us about some of that. So the floor is yours.
I was just wondering if there are any service developments planned for Ashford Hospital or anything you can tell us about the future there?
Absolutely. Ashford's a very important part of our strategy going forward.
This winter has been a challenge, and we know that. And we know that we've had to, for example, pause elective surgery for a lot longer than we'd like to have done. So going forward, what we're doing is looking at how we can use Ashford differently. So a piece of work that the surgeons are doing at the moment, led by Mr. Irikula, is looking at what we could use Ashford for in terms of surgical activity. So we already do the vast majority of our elective orthopaedic work at Ashford. We're probably working the theatres 6-7 days a week. But we're looking to see what can we do to increase that. And it might, so one of the things we're looking at, although we haven't agreed at the moment, is looking at can we move more elective surgery over in the way that we do orthopaedic surgery. Also looked at increasing some of the day case work that we send through the infusion suite, which is moved to Ashford, so that's a very busy unit, and also our breast service is based there. So we're looking at a number of things. There are a number of important trust services there, and we're looking at a range of things that we can continue to develop there as well.
In the recent staff survey, it says that part of this hospital's problem is bullying and harassment. And I just wanted to know, what were your thoughts on how to combat it?
We, like you, are disappointed to see that still being represented in the survey. So you're quite right. It's something we have to pay really serious attention to. And actually, we can give you a sense of the thinking around that, but we can't fix this. We all have to fix this.
So there is something about having conversations within your own teams about what can we do to respect one another and what can we do to change the way in which our department feels if it doesn't feel right.
My name's Megan McGee and I am one of the research nurses in oncology and surgical research. Mine was more just a comment on what this lady just said. I'm also a Freedom to Speak Up ambassador for the Trust, and I just want to promote that alongside what you've just said. There's a team of us who, if you fill out a Freedom to Speak Up form on the TrustNet, that will be fed back to Jackie Reese, who will then give your case over to one of us, and we will work closely with you if you wish, and we will be directed by you in how you want us to approach the situation.
So I'm going to draw us to a conclusion. Thank you all very much for your contribution, and we will answer the questions, including your question about banking agency, more fully through an Aspire message. And have a great rest of your day, everybody, and thank you for your time.
Well, we hope you enjoyed our first Team Talk event. Thank you for everybody that came along and for those people that have subsequently watched the video online. There is a survey that's been distributed around what people thought of the event. Please do contribute to that and let us know what you think we could do better and what you think went well. And also please do contribute future questions to the events as we go forward, which are going to be held every quarter.